Let's bow our heads as I read from the first chapter of the Holy Book, the Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. Thank you.
Thank you, Your Excellency. Kindly, we may take our seats. Your Excellency, we are just going to use 2 minutes of your time. We invite a dance, just a short dance for 1 minute, and then we continue the program. Kindly.
You're a good soldier, choosing your battles. Pick yourself up and dust yourself up, get back in the saddle. You're in the front line, everyone's watching. You know it's serious, we're getting closer, this isn't over. The pressure's on, you feel it, but you got it, don't believe it. When you forget up, and if you forget up, Zamina, Sangalewa, 'cause this is Africa. This time for Africa. Listen to your God, this is our motto. Your time to shine, go and line, y vamos por todo. People are raising their expectations. Go on and feel, and this is your moment, no hesitation. Today's your day, and feel it. You paved the way, believe it. You get down, get up, and you get down, get up, Zamina, Sangalewa. This time for Africa. Zamina, waka waka, Zamina, Sangalewa. Anawa, Zamina, waka waka, Zamina, Sangalewa. This time for Africa. Somebody. Waka waka ma hey, waka waka ma hey. Somebody. 'Cause this is Africa.
Thank you very much. Let's give them a hand of applause as they leave the stage, kindly. Waswahili wanasema katamu kadogo. Thank you very much. Your Excellency, the Deputy President of the Republic of Kenya, Professor Kithure Kindiki, Your Excellency, the Governor of Nairobi, Governor Ray Johnson Sakaja, Your Excellency, the Deputy Governor, the CEC Health, all the protocol observed, distinguished guests, ladies and gentlemen, it is my distinguished honor to invite the CEC Health now to come and make her remarks and then invite the Deputy Governor. Welcome.
Your Excellency, the Deputy President, Your Excellency, the Governor, Your Excellency, the Deputy Governor, Chief Officers, CECs present, my health staff, wananchi wa Nairobi, medics, and all protocols observed. Good afternoon. My name is Susan Silantoi. I'm the CEC for Health, Wellness, and Nutrition in Nairobi County. And I'd like to welcome you all to the very first Health Scientific Research Conference hosted by Nairobi County. The theme of this, we have 6 themes for this conference. This includes our commitment to health equity. It includes our commitment to integrate NCD services within our services, our commitment to community mental health initiatives, health technology advancements, incorporating innovative approaches in our services, and also climate resilience in health. The team has taken time to prepare 3 full days of activities and knowledge sharing amongst our scientists, our medics from all over the country. We received over 300 abstracts, and we picked a couple of them that we'll share with you during these 3 days. And so we welcome you very much to engage with us and continue to learn with us as well and take this journey. Over the world, governments are the ones that take precedence in leading research and leading knowledge management and knowledge sharing. And so Nairobi County, through the leadership of His Excellency, the Governor of Nairobi, we are taking that step to ensure that we are leaders even in knowledge in our country. And so I won't take too much of your time. I want us to just introduce the teams that have been here. So I'll start with the team that put together the conference. If you're part of the committee that put together the conference, led by Dr. Muchoki, who's the Chief Officer, Medical Services, please stand. I would like you to wave to the team. That is the team that has put together this work, this very excellent work, and a job well done to you. If there's any county chief officer present, please stand up. I'd like to recognize your presence as well. Please wave to the crowd. I have one of my colleague waziris who is present today, Mike Gumo. He's in charge of ICT. His team worked very closely with my team to put together this team as well. For my teams, my CEOs for the level 5s, please stand and wave. They're part of the team that lead the change management in our team. That's them. They're right there for Mbagathi, Pumwani, Mutwini, and Mama Lucy, together with Mama Margaret as well. I'd also like to recognize all my directors from the county. If you're a director from the county who works in health, please stand up and wave. That is a team that leads that excellent work. My sub-county teams, together with anybody who works in any of our facilities, please stand. Please stand and wave. We would like to see you. A lot of our abstracts were also received from our staff, so some of them will also be sharing their knowledge here as well. I'd like to recognize our partners, the partners that have supported us here. We have some platinum partners, that is APHRC. Please stand and wave. We have USAID, Fahari Ajami. I don't know if we got a there we go. We have Roach, Dr. Alan. We have the World Food Program as well. We have GAIN. GAIN is one of our nutrition partners. We have Strathmore Business School. We have UNFPA. We have Jubilee Insurance. Ms. Njeri Njomo is here. We have our team from Food for Education who helps us with our feeding program as well. And together with the rest of the team, that is the team that has put together this particular event. And so, Your Excellency, I know you're in a bit of a rush, and we want to really thank you for joining us today. I know my teams are very excited to have you here. This is our first county event that you've come, so we are glad that it is health that you chose to come to. And so, because we don't want to take too much of your time, without further ado, I will welcome the Deputy Governor to speak. Thank you.
Your Excellency, the Deputy President of the Republic of Kenya, Professor Kithure Kindiki, Your Excellency, the Governor of Nairobi City County, Sakaja Johnson, distinguished guests, ladies and gentlemen, and all our partners. As you've been told, my name is Njoroge Mushiri. I'm the Deputy Governor of Nairobi, And I'm happy to be at this scientific conference, the first one in Nairobi. And I want to say that I am not a master of this science. Nothing in my history interacts with this. But what I know is that healthy people, Your Excellency, are happy residents of Nairobi and are happy voters. So I want to thank the scientific people who have come together to ensure that the people of Nairobi are happy and healthy, because then I can see a relationship with them in my next role. And with those very few remarks, I would like to invite His Excellency, the Governor of Nairobi City County, His Excellency, Governor Sakaja. Please be upstanding as we welcome the Governor of Nairobi to come and talk to us. Your Excellency.
Please be seated. You know, Your Excellency, the Deputy President, we're not used to having somebody else. So when they were standing, I almost pulled them down. You can't stand when the Deputy President is here, until when I call him. I'm really happy today for this historic meeting, the first ever scientific health conference for Nairobi City County. Your Excellency, Professor Kithure Kindiki, Deputy President of the Republic of Kenya, the Deputy Governor, CECs, all present, members of the health profession, our partners, whom we are very, very grateful to for working with us throughout this journey and in many aspects within the county government. Distinguished guests, ladies and gentlemen, good afternoon. Thank you so much for being here. It's really my pleasure to welcome you all here today and to extend an especially warm welcome to His Excellency, our Deputy President, Kithure Kindiki. Karibu, my big brother and my friend, to the first ever Nairobi County Scientific Health Conference. This is a day that we shall remember for a long time. As the Deputy Governor said, I'm also not a health professional, but I rely so much on the amazing team that you've seen here to deliver health services in Nairobi. I acknowledge all of you. I thank you for the tremendous work we've been able to do in the last 2 years, and I think you deserve a hearty applause for what we've achieved. Your Excellency, on my 20th day in office, after having been sworn in as the Governor of Nairobi, and after having visited one of our facilities, which was always on the news for all the wrong reasons, I set up, in fact, my first executive order was to set up a health reforms task force. It had distinguished professionals within the health sector and from all aspects in the entire value chain, from HR to ICT to commodities. And they churned out a report in 45 to 60 days that has been our blueprint in implementing healthcare. Normally, many of my colleagues or people in political office, as soon as they get elected, they go and cause a scene in a hospital, and they say, this is the last time, this must change, and they start shifting people and doing all manner of things without science and without listening to the professionals. We listened to the professionals, and that's why I'm proud that we've achieved quite a bit in Nairobi County. But let me begin with reflection of the moment in which we find ourselves. First, the post-pandemic world. We all saw for ourselves how a completely unexpected pandemic upended the lives of nations and many families in our country. Second, persistent and occasionally growing health disparities amongst our people, and that is, so the case even after devolution. Third, seriously, deeply tangled public health problems that are very difficult to solve. Everything from the past legacy of urban planning to pollution to the speed of today's urban growth means that public and preventive health is much harder than it was a couple of decades ago. And yet, the demand and the necessity for preventive and public health remains as strong as ever. Fourth, higher expectations. Information is cheaper, it travels quicker than ever. Our people can compare costs, quality, and coverage of medical services more or less immediately. So these are some of the difficulties and the context in which we find ourselves. But let me say a little bit about the opportunities that we have. First, we have access to better research and information than ever before. Secondly, as you can see today, we're getting better at forming partnerships with the national government, with academia, with the private sector, with foreign friends. Thirdly, and following from the pandemic that ravaged much of the world, I think we are all now locked in. If there's one thing that the pandemic has taught us, and by us, I mean everyone who is in a position of responsible leadership, it is that health policy is really, really important and truly a matter of life and death. We know it matters and it has a real priority, more than pre-2020. So I'm very pleased to be here with you to encourage your deliberations at this conference and to encourage you also to make it a regular event. I believe we can be able to do so. Our theme, which is advancing health equity towards resilient and sustainable, people-centered primary healthcare systems for Nairobi, embodies our dedication to addressing the persistent health disparities faced by our people. And let me say a little bit about that, Your Excellency. In Nairobi, access to healthcare is not a universal reality. National data highlights that while Kenya, with a population of more than 50 million residents, and Nairobi City County making up to 5 million of this population, has made strides in increasing healthcare coverage, but disparities still exist, particularly amongst urban communities and the urban poor. Approximately 50% of urban residents throughout the country lack convenient access to essential services within a 5-kilometer radius. They can access it, but it's not within a 5-kilometer radius. And with low-income neighborhoods experiencing the greatest barriers. An opportunity for our administration during this tenure to bridge. And Your Excellency, I mentioned somewhere where you're not, that I'm very blessed to have a very good deputy governor. And I said, I was telling the president, he's like yours. He's a nice guy. And also a wonderful CEC, who I'm very proud of, our CEC for health. I'm extremely proud of her. She's the youngest CEC in the country, And she became health CEC at 29. She's no longer 29, but that's when she was. And you can imagine leading people the age of your parents, but really marshalling them towards a common vision. That is exemplary leadership, as well as my chief officers. Thank you so much. So we believe that this is a gap that we must bridge, and we're going to bridge as a county government. For our county, this conference is a unique opportunity, and we really appreciate all of those who sent abstracts and your participation. We take it seriously. We're not doing this just to have an event. We actually take it quite seriously and we implement. And it's an opportunity for us to confront these challenges head-on. We have already made notable achievements, Your Excellency, in expanding healthcare, the expansion of primary healthcare facilities over the last 2 to 3 years, because it started just before you got in. We've built and equipped our county referral health facilities to offer comprehensive specialized services, bringing crucial services closer to those who need them most. We've increased the number of community health promoters, and we were the first county to start them on a stipend. Your Excellency, and we're so lucky, we have a deputy president who believes in devolution, because health is the biggest devolved function. He believes in devolution so strongly. You remember when we were in the Senate together, when we had a motion on community health promoters that I was pushing, you really supported, and true to that, we were the first county to put them on a stipend of 3,500. We now, thank you, we now have 7,820 of them, all kitted thanks to our partnership with the national government, covering close to 800,000 households in the county of Nairobi. And we're happy that, these days they receive stipends from the county government and from the national government. So sometimes it's a competition. Wanasema ya Ruto imeingia ya Sakaja bado. Or sometimes ya Sakaja imeingia ya Ruto bado. I know we're working on having it collectively, but they're happy. I interact with them. I'm on their WhatsApp group. We joke. We marshal them. They're helping us register people to SHA. And, if we change the denominator being used currently in that analysis, Nairobi is actually top. We're close to 1 million registered so far in the Social Health Authority. These volunteers, or promoters, as we call them now, are our frontline heroes, providing preventive services, health education, prompt referrals, and maternal and child health support directly to underserved communities. But let me emphasize that this is only the beginning. We expect more work from them, greater partnership. Let's resource them more, let's educate them more. There's so much we can achieve with that network. And I'll be very pleased to hear from this conference ideas and suggestions of what we can do to improve this critical health service. We have also been able to bridge gaps in infrastructure, Your Excellency, by building and equipping the first blood bank in Nairobi. We now have more than one. Renal unit, Nairobi had none, to my surprise. We launched an eye hospital, not a clinic or a department, a fully fledged, the first public eye hospital in the Republic of Kenya is in Umoja. We launched it, as well as intensive care units and neonatal intensive care units. Yesterday, or the day before, if I'm not wrong, was a day for preemies, premature babies. Yeah? Or we say those born before their time. And whenever I go to Mbagathi, Your Excellency, I encourage the mothers, because I look at them doing kangaroo or whatnot with their babies, and I tell them, don't worry. Premature babies end up becoming governors. You know, I was born many months before my time. So I tell them, don't worry. They become big. Now, wasumbufu, saa ingine. Your Excellency, we're also in the process of fully operationalizing Mama Margaret Kenyatta Hospital. We're soon hiring close to 1,000 health practitioners, because that is a hospital that will reduce greatly the pressure in the Eastlands and the pressure being faced at Mama Lucy Hospital. So Mama Margaret Hospital is the next, and there are plans in many of the hospitals. One of the most noble interventions we did as we got in was in governance of delivery of health services. As part of the task force report recommendations, they recommended that we have chief executive officers at our level 5 facilities and level 4 facilities, in addition to the medical superintendent. So you have the medical superintendent, but you have a CEO who looks at the 360-degree, areas of health service provision, who can think about, is the water running, how customer service, how are people treated from the gate, do the doctors have what they require. And I'm very proud of my CEOs who are here. Please stand up. You have been introduced. We have Martin, who's CEO of Mama Lucy Hospital. If he starts talking, Your Excellency, you will not leave, because of the things he's done at Mama Lucy Kibaki Hospital. It is not in the news the way it used to be, apart from sometimes sponsored stories. Christine Pumwani doing an amazing job. The community now owns Pumwani Hospital. Before, our colleagues, especially from the Muslim community around Pumwani, would never go to the hospital. Today, they're there, in big numbers. Great work you're doing, Christine. Fred is at Mutuini, which is now Mama Rachel Ruto Hospital in Dagoretti South, doing an amazing job. They had no equipment before. Today, people are being referred there from private facilities for their radiology equipment that they have at Mama Rachel Ruto Mutuini Hospital. Thank you so much. And of course, Dr. Alex is at Mbagathi Hospital, which is now, it's going to be our center of excellence for diabetes. It is now in partnership with KEMRI as the first research hospital, a first county research hospital in the country because of our partnership with KEMRI. Thank you so much. Because of time, I will not go through the entire speech, but I just want to say some of the things we can reflect on together on what our county asks for from this conference. First, I hope that we learn how to improve the structure of primary health care. We've seen its impact. Many people do not need to get to hospital. And by the time they get to hospital, then it's, things that could have been managed become worse. We're laying the groundwork for a more inclusive, more democratic, more sustainable health system, but you can only learn by reflecting together and learning from your advice. Policy makers are here to listen. Even if you see myself walking out, or the Deputy President, our teams are here. And the recommendations and report from this 3-day conference shall be submitted, Your Excellency, to your office, also to, for honor transmission within Cabinet and to the President to see Nairobi must be a model of what we can do in this area. Healthcare is a powerful equalizer of life chances and quality of life. Secondly, our deliberations here will help address Nairobi's challenges. Doctor to population ratio. It's a significant hurdle. Of course, also because of health financing. We must unlock health financing. And I'm really happy with the progress and now the uptick, because people are beginning to understand the concept the concept behind our social health insurance and social health authority. Every new initiative stumbles or falters as it starts. But if you look at it, and I say it with confidence as a health service provider, you know, I've sat with my teams and I've gone through it myself. When I go to Mama Lucy just to visit and see what's happening, many times, in fact, I have a personal bill there of the people I have to bail out. 70 women, 80 women. Alex, what's my bill in Bagathi? But usinimulike sana because I'm paying. Yeah, I make a point to pay. But you find ladies stranded because they cannot pay, you know, or they cannot be released in many of our hospitals, especially those who go through C-section. Yeah? That should never be the case. When a child is, you know, the bounty of joy that a child brings should not immediately turn into suffering or despair in that family. If you look at the amounts that are going to be paid by everyone responsible, it was not fair for myself or the Deputy President to pay a similar amount as possibly that lady there or somebody earning 20, 30, 40,000 shillings. Let's all sacrifice for each other as a country. You know, we need to look out for each. I know the economy has made us competitive to a fault. We all look at what we are going through, but we must look out for each other. The benefits package as it is, of course, needs to be, you know, continuously improved. There are more things that we can do, but it's the best deal for our country. I am convinced as a governor that we must make it work. In Nairobi, we say lazima iwak. We never take no for an answer. We are resilient, and we say lazima iwak. So whatever it takes to make it work, let us do that. The capitation, you know, when we are encouraging people to register, we know that for everyone who registers at a facility, we get capitation of around 900, whether or not they come to that hospital. So the days of people going to auctions, I mean to Harambees, all of you I know are in a WhatsApp group or have been in a WhatsApp group for a medical bill. To say ukweli, isn't it? Who has never been in a WhatsApp group? It says something about you, your personality. If you have never been put in one. Can we at least yield a bit so that we can stop being in WhatsApp groups? Kila mtu apate afya ambaye anahitaji, isn't it? I think that is one of the most noble things we'll do. Thirdly, our focus on resilience is also critical. The pandemic demonstrated just how essential it is to have a system capable of withstanding unexpected pressures. I hope Parliament can go on to enact the bill that we proposed that time. You remember, Your Excellency, I was chairing the COVID committee, and we came up with a bill on pandemic response and management. You know, yes, COVID was one in 90, 100-year pandemic, but time and time again, something can come up. We need to, and we realize we have a soft underbelly as a country when it comes to this quick response. What protocols are invoked? How do we invoke those protocols but remember the rights, the human rights issues of the citizens? You know, how do we marshal resources beyond the normal bureaucracy of getting things done when a pandemic is declared? And what then determines the threshold of having declaring something a pandemic? That is legislation that I think is still important. The draft bill is there, Your Excellency. I hope you can be able to look at it within cabinet so that we have a clear protocol of engaging when a pandemic strikes, because you never know, you never plan for a pandemic. Strengthening emergency response capabilities, and you know in Nairobi we always have a lot of these emergencies, unfortunately. After this I have to go to Mbagathi. We have a lot of casualties from a fire yesterday in Majengo. We've been having so many fires across. We need to be able to enable people at the lowest level respond to this and also to prevent this from happening. And finally, this conference provides us with a valuable opportunity for collaborative solutions and knowledge sharing. I want to assure you, our partners and those from the private sector, Nairobi means business. We are open, we're open-minded, we're ready to hear your ideas, we're ready to remove the red tape that for many of you have prevented your ideas from being taken up by government. For those in academia, there is no better place to actually pursue your research and study than Nairobi County. It is the biggest health service provider in this country. We provide more health services than any other county because of the population we have. And remember, health is devolved. So which better classroom than Nairobi County government? The insights gained here will help us shape our healthcare policies expand our services, and most importantly, improve health outcomes for all Nairobi residents. So for our partners and donors, thank you for your support. Thank you for your donations. I assure you they will not be returned. We accept them because we asked for them. I encourage everyone here present to actively engage in these discussions, to share your experience and expertise, and to take full advantage of the resources that this conference offers. Thank you for being here and for your continuous commitment to advancing health, equity, resilience, and sustainability. Together, we are paving the way for a healthier Kenya and a healthier Nairobi. Lazima iwak. Asanteni. Now, ladies and gentlemen, kindly join me in welcoming His Excellency, the Deputy President of the Republic of Kenya. Let us clap until he gets up on stage.
I request you be seated kindly. Thank you, my brother Sakaja, Governor of Nairobi, and your deputy, and all the senior dignitaries here from Kenya and outside Kenya. I recognize all of you. It's a pleasure to be here. The governor did make some disclosures that we have had quite a history spanning over 12, 14 years. He was chair of a party we formed together, a political party called the National Alliance, which governed this country at some point. And that time, although he was praising his CEC for health, for being a young CEC, he was just modest because he was the youngest chairman of a political party in power, National Alliance, at 28, isn't it? So, Governor Sakaja and the teams and partners, we wish you well. You're doing a good job in Nairobi. We are proud of what you're doing. I want to assure you, from where we sit, we will continue supporting and collaborating with you. Thank you for the kind of positive vibe that I see between yourself and the teams and the partners, because that's what it takes to deliver. That coherence is very important. It's more important than anything else. And I hope you continue working that way by appreciating the role of everybody and just being fast among equals in a huge team of people. Some of them are not even lucky to sit here in this conference, but they are working hard to make sure that Nairobi is working. So, having recognized the protocols, let me also make a disclosure that I'm not here today in my own capacity. Some people may think I came here because I'm the friend of the governor. I came here to represent my boss, His Excellency President Ruto. He sends his greetings and love. And therefore, on his behalf, I am happy to be here and to address you, and I wish you all the best in the remainder of your conference. The theme of your conference, Advancing Health Equity Towards Resilient and Sustainable People-Centered Primary Healthcare System for Nairobi, aligns perfectly with Kenya's development priorities, including the bottom-up economic transformation agenda and the Global Sustainable Development Goals, SDGs. One of the most pivotal sustainable development goals is goal number 3, which is good health and well-being, which aims at ensuring healthy lives and promotion of the well-being of all at all ages. This goal is central to today's discussions as it encompasses universal health coverage, health system strengthening, and reducing health inequities, priorities that this conference seeks to address. The theme is further buttressed by the African Union 2063 agenda, goal number 3, which is on health and well-nourished citizens. Kenya, like other nations in the continent, recognizes that health and nutrition are cardinal in fostering and sustaining the well-being of our society. Ladies and gentlemen, the need to focus on the health, wellness, and nutrition of the population is born out of the reality that health access, affordability, efficiency, and responsiveness have been a challenge for many years. Our citizens are not only limited by the long distances they cover to be able to access facilities in far-flung and rural areas of our country, but also there is the challenge of the high cost of health services. Access, therefore, and affordability to specialized services are higher than most taxpayers can afford. These specialized services are often localized in particular the facilities of towns such as Nairobi, such that ordinary citizens face a double challenge of traveling long distances in times of health distress for critical services. The double jeopardy is in having to cover long distance while you're unwell. We know that health disparities exist, with rural populations more vulnerable to undernutrition and infectious diseases, while urban areas are increasingly facing lifestyle diseases due to sedentary habits and poor dietary choices. Likewise, our nation is facing the challenge of sustaining our health system against unpredictable global health dynamics. But pandemics like COVID-19 have proved that contemporary systems must be bolstered to withstand unprecedented times. Investing in technology and research will certainly go a long way in mitigating on the impacts of unforeseen health threats. As such, the government of Kenya continues to invest in modern technology, especially in medical infrastructure, which is core in diagnosis and treatment. I am aware, distinguished guests, ladies and gentlemen, participants, that this conference will also examine the sustainable practices within healthcare systems, encompassing environmental considerations and resource management for improved service delivery. Prudent environmental and resource management is a gateway to ensuring sustained provision of quality health, and as accordingly, digitization of health services and facilities is an integral part in optimal resource utilization as it enhances accountability and fosters a culture of stewardship. Distinguished guests, ladies and gentlemen, nutrition and health diseases in Kenya today are shaped by a combination of factors, including dietary habits, socioeconomic challenges, and access to health care. Malnutrition remains a major public health issue, with both undernutrition and overnutrition affecting different segments of the population. Governor, once more, thank you for the Dish in a County program. Many people who can afford a meal or 2 or 3 a day will not understand the profound impact of providing a meal to millions of children in Kenya today who really find a lunch or any other meal a luxury. So you're doing a good job in trying to alleviate the pain and suffering and the discomfort of our children in this city who are made more comfortable by that program to have a meal and therefore be able to be alert and be receptive, and therefore enhancing their performance in school. Asante sana. So nutrition and health diseases, as I've said, in Kenya today are shaped by a combination of factors, including dietary habits, socioeconomic challenges, and access to health care. Malnutrition remains a major public health issue, with both undernutrition and overnutrition being problems to different parts of or segments of our population. Children are mostly affected in terms of undernutrition. This is driven by food insecurity, poverty, poor maternal health, and inadequate access to diverse and nutritious food. On the other hand, we have the problem in the same city, same country, of overnutrition, with an increase in diet-related non-communicable diseases like obesity, diabetes, hypertension, and cardiovascular diseases. These are more common in urban areas like Nairobi, where processed foods high in sugars, fats, and salt are readily available. We also face a high burden of infectious diseases, including malaria, tuberculosis, HIV, and AIDS, which continue to increase the health burden of our public coffers. One way to ease our financial burden is therefore to focus on preventive measures. President Ruto's administration is focused on improving the nation's food security, nutrition, and health care through deliberate interventions. Having anchored health as a key pillar in the development agenda of our country, the government set a roadmap for both the national and county governments on promoting the well-being of Kenyans. Universal health coverage, UHC, currently being implemented is part of the broader strategy to provide accessible, affordable, and quality health care for all Kenyans. UHC also aims at expanding health services to undeserved areas or underserved areas through integrating digital solutions to streamline healthcare delivery. The government has made significant progress in increasing access to health services through its partnership with county governments, local health providers, and the private sector. This includes in the rollout of the Social Health Insurance Fund, SHIF, which offers comprehensive coverage, including outpatient service, preventive care, chronic disease management, and specialized treatment. It also increases improved efficiency and accountability in the healthcare service delivery. To improve accessibility to healthcare services, the government will continue to upgrade health facilities across the country, especially in rural and underserved areas, even within our cities. Similarly, we look forward to enhancing digitization of health services across the country. We call upon county governments to continue collaborating with the national government in the provision of affordable and accessible health services to the people of Kenya. Further, the Kenya Kwanza administration is keen on strengthening primary health care systems through harnessing the capacity of community-based services, preventive care, health education, which are essential in reducing the burden on tertiary and referral hospitals. And I think Governor Sakaja has said it. If we invest more in preventive health care, we will have fewer people going to hospitals because right from home they can access medical advice, medical education, preventive medical information for preventive care, and therefore it will be needless. Some of the interventions will help these people prevent going to hospital, and if they go to hospital, it's likely to be at level 2, 3 kind of hospitals, and therefore the bigger facilities will be reserved for complicated, chronic, and serious ailments. And therefore, going forward, we must continue with this partnership and providing investments both at county level, national government level, to the health sector. I note that investment in the health sector calls for massive financial and human resources. Certainly, acquisition of the latest health infrastructure, expanded service provision, and promotion of preventive measures demand significant resources. The more reason the two levels of government, international and local partners, must pull in the same direction to make sure that we have enough human and financial resources, equipment, and everything else that we require to be able to roll out a health care system that is inclusive, accessible, affordable, and within reach to the majority of the people of Kenya. So far, I just want to commend the very, very profound and consequential partnership that has generated the provision of over 100 community health promoters across Kenya, partnership between county governments and the national government. And thank you very much, Governor Sakaja, the governors, all the other 46 governors in our country. You were very open to this partnership, notwithstanding that the fact that health is devolved, and there's nothing wrong in national government supporting county governments to deliver health, because I think the initial days of the struggles for who does what function, I think those days are now behind us. There is nothing, even in our devolution structure, that suggests that the national government cannot support county governments to deliver on the functions that are vested with the county governments. Therefore, I think that's a highlight. I think the next level of partnership in the coming months and coming days is going to be in the provision of diagnostic and other equipment at the hospitals, especially level 2, 3, and 4, maybe 2, 3 hospitals, because that's where it matters. If we get proper diagnosis in level 2 and 3, we will absorb the burden that now level 4 and 5 and 6 are facing, and help very many people and make health more accessible to many people in our country. Through collaboration with development partners, county governments, and other stakeholders, we will gradually make the impact by improving the well-being of our citizens. This conference therefore serves as a step in the right direction towards enhancing and sustaining joint efforts in promoting health, nutrition, and the well-being of our nation, continent, and world in general. I therefore urge you to harness the opportunity and set pace for all the other counties, because as the governor has said, of course, he should have waited for us to say it, Nairobi is the premier county. Nairobi, for us in Kenya, is our firstborn county. Nairobi leads, the rest of the country follows. It is the gateway to our country, and therefore, what Nairobi does in matters health is definitely going to have a ripple effect on what the other counties will do in our country. So next time, Governor, just wait until we give you the accolades and the praises. As you are aware, Nairobi County is the centerpiece of Kenya's operations. Leading in matters health will therefore definitely trigger a positive ripple effect on the other counties in our country. I respectfully submit that deliberate initiatives by the county governments, especially in low-income areas, will go a long way in enhancing grassroots service delivery. The die is cast, the citizens are expectant, the high expectations the governor talked about. Delivering our promises will leave footprints on the path to prosperity. Let us therefore unite in doing our best, our honest part to serve the citizens of this great republic. I just want to say two other short and very quick things, just to emphasize what I've said in so much English. That this country is one. We have one indivisible country. We have one national interest, and we have one national priority. That national priority is, and the national interest is in ensuring that Kenya remains viable, Kenya becomes progressively prosperous, and Kenya remains one united and one prosperous country for all its people. That is the national vision. And therefore, the devolution that we so much cherish is to help us harness that, the fundamentals of that national vision, to make us work faster, more efficiently, so that we realize our objectives in a quicker format. I say so because we will need to emphasize the need for us to rally ourselves so that we realize our national objectives and the national vision. The survival of this country, many decades from now, many centuries from today, when many people in this room will not be present, lies in forging and clarifying our national vision, our national interest, and working towards it, all of us, all the levels of government, all the arms of government, other stakeholders in the society, non-governmental actors, international partners, the academia, the citizens of Kenya, all of us, we have a role to play to strengthen not only the health systems of our country, but to strengthen the prosperity, inclusivity, and the unity of our country. It's very important for us to repeat that. Yesterday, His Excellency the President, while addressing the nation on a different matter, did emphasize that we do have a few challenges in some of the sectors that this administration is trying to reform. Health is one of them. The Kenya Kwanza administration's agenda for health, which has resulted in the current reform movement, is anchored in the national vision that I have already said, and it is for the better of this country. That reform is not just to change and revamp health institutions, but it is to ensure that the new system reaches out to as many of our people as possible, so that health, nutrition, does not become a preserve of some people in Kenya. It becomes accessible and affordable to as many people as possible, those who call Kenya home. And the President did say, which I want to reiterate, that SHA and the health reforms, challenging as the reforms are, those reforms will succeed. And he said, because those reforms are well-intentioned and anchored on our national vision, the reforms will succeed so that way, those who think a country like Kenya, a developing country, with all its challenges, cannot roll out a successful health reform program that has been impossible to roll out in some of even the developed countries. Those who think that a country like Kenya cannot do it will live to see the success of this program, because it will succeed. And he said it will succeed because we have clear vision what this means to the people of Kenya, what a healthier population means, because it means a healthier population means a more productive people, and that will help us in terms of our economic goals and the other aspirations that we look for, including the stability of our country. So, ladies and gentlemen, we will succeed. And you, Nairobi County, and the other 46 counties, you are going to be the determinants. What you do in this sector, in the other sectors, will determine whether we will put this country on the path which we have always desired to put it. I wish you well, I have a lot of faith in what this conference means for Nairobi and for Kenya. In my past life, I was an academic, and I know science moves the world. I am glad you're meeting here to talk science and to talk knowledge, because we can have as many programs as possible, but unless they are informed by science and knowledge, they will not be sustainable. So I really wish I could stay longer here and listen and learn. But as the governor has promised, please submit your research findings, recommendations, deliberations, and outputs of this conference to the office of the president, so that we can also learn from what Nairobi County is doing, and we can also learn from the reflections of this meeting. If we do that, and we meet here next year, perhaps, God willing, we will then be in a position to examine what we'll have been able to achieve by that time. Other than that, once more, I want to thank you, wish you well, continue praying for Kenya, continue wishing our country well, and let us learn from each other and learn that a nation is built by its own people, and there are no other people. We will do it for ourselves, but we will also do it for the generations that are not born yet. That is what we are supposed to do. I wish you well. I know there are a few issues outstanding, Governor, between national government and county governments. We are working on, as chair now of IBEC, the Intergovernmental Budget and Economic Council, which brings the two levels of government together. We are unlocking the funding and resource issues and a few other issues that are outstanding in a very mutually respectful manner. We want to build cordial relations and build that synergy that is positive for our country's interest. And therefore, going forward, we'll have many more of these events. I wish you well. Thank you very much. God bless Kenya. God bless our city, Nairobi. Asante sana. I forgot to declare this conference officially open. Thank you very much.
Oh, wow. Thank you so much, Your Excellency. A better round of applause, please. As the pyrotech, I think we need more people here. I'll call the MCAs. I've seen the Chair of Health and two committees. This is Honorable Morris from Mountain View, Chair of Health Committee. Honorable Karani. Ramsalimia, Deputy President, Hamjawai. Honorable Karani. Honorable Maragu from Karen. Oh, the Vice, Honorable Reki, Kimani Mugo, Zimmerman. I think the Vice Chair is here. Lily Kidenda and Lydia, please, let's flank. Then we'll have a photo with our partners. And then our health management team. The Deputy Governor. Please, the two of you to this other side. Mwanaweza kutupanga, yeah. Just arrange. Where's the CC and the team? So you can do 2 rounds of photos, just. Then we can do another row.